Hello, everyone. Thank you for being here today. I'm Arka Deb. I'm one of the co-chairs for the Gun Violence Prevention National Steering Committee for Doctors for America. And I'm a psychiatrist in Baltimore City, in Baltimore and New York City. And I'm very happy to moderate this session here, the Advocacy Grand Rounds that we have every month for Doctors for America. Today's grand rounds is, well, the purpose of all of our grand rounds is to provide our 20,000 physicians, medical trainees, and other healthcare professionals with courses, anything, monthly trainings, anything to support their advocacy efforts, modeled after clinical grand rounds that we've all been through. But we hope that this will also provide doctors and medical students with an opportunity to connect with others doing healthcare advocacy work of interest to them. I encourage everyone to send future events to friends and colleagues and organizations that you work with, and to send us suggestions for topics or speakers you'd like to see in the future. And we do these events at 1 and 8 p.m. and to maximize everyone who can attend. And we will be live streaming to Facebook and making recordings, and materials will be available afterwards if there's materials. Now, some ground rules. There's no such thing as a stupid question, just like your kindergarten teacher used to say, your mother used to say. Please use the question and answer feature here, and we will address questions in the second half. And we'll also say that, in terms of sort of learning about advocacy, this is a first step for some and a continuing education opportunity for others, right? We're all at different stages in knowing about advocacy. Just be mindful of your stage, your journey in learning, and we want to help everyone out. Okay, and one thing that our staff is going to handle right now, just so we know a little bit about our audience here, we're going to launch a couple short polls here, okay? And our staff is going to handle that real quickly, and then I'll go ahead after maybe taking a minute. Then after that, we will speak to, then I'll introduce our speakers here. I'll just give 1 minute for that. Questions are, where are you tuning in from? Is this your first advocacy grand rounds? Do you feel comfortable finding policy resources on the issues you're interested in? And are you comfortable making appointments with legislators and talking to them? Okay, now I'll just move on from that now. Okay, so today's topic is the most important one. Okay, I think it's the most important one. Policy resources and meeting with your legislature. Now, I'm going to introduce our panelists here. I'm really happy they're here. I'm just excited that they can give a little bit of their time and what they do every day. I'm just happy to be around them. And I'll just share a little bit that before I finished medical school, I was an intern on Capitol Hill way back in 2008. And one of the big mistakes I might have done is when I was finishing my internship, the folks at the committee asked me, well, would you like to continue working or would you like to stay? And I said, well, I think I need to go back to medical school and finish training. And then about a year or two later, I learned that they actually wrote the Affordable Care Act bill, and they got to put their stamp on it. So I'm glad I went back to med school, but over on Capitol Hill is where they made the difference, and now a lot more people have health insurance, and our system is continuously transforming because of it. Okay, so let me go ahead and introduce our speakers here. First, I'll begin with Dr. Stephanie Kang, and she currently serves as Health Policy Director for Congresswoman Pramila Jayapal, and she completed her Doctor of Public Health degree at Harvard T.H. Chan School of Public Health. I think we've heard of that place, right? Worldwide, wonderful public health school. And as Health Policy Director, she assisted in crafting Medicare for All legislation in the U.S. House of Representatives. And she executes legislative actions and political strategy in coalition with several organizations to promote Medicare for All, drug pricing, and other health policy priorities inside and outside of Congress. Her professional background includes founding and scaling several health equity-centered organizations, conducting quality improvement in healthcare settings, and working in community-based global health projects. Okay, and we'll also introduce Matthew Wellington here. He's the Public Health Campaigns Director for USPIRG, Public Public Interest Research Group, a nonprofit advocacy group. Matthew has appeared on NBC Nightly News, MSNBC, local TV stations around the country, and he's been quoted by everyone, every news outlet. He's worked for USPIRG or its state groups for 8 years, runs PIRG's COVID-19 response efforts, as well as campaigns to keep children from getting hooked on tobacco and to try to stem our antibiotic resistance epidemic. We have an epidemic of that. Matthew, you can also correct me if it should be US PIRG or USPIRG.
US PIRG, that's right.
Okay, very good. Okay, so we're going to go into a couple presentations, and after that, we'll do some question and answer. So Dr. Kang, I'd like you to just go ahead and first and do your presentation.
Awesome. Thank you so much for the introduction. Thanks for having me. I always love being part of Doctors for America's events. I think I really just believe in the power of physicians, medical students, clinicians being able to leverage their standing in society and be able to affect really meaningful change. And so really love the platform that y'all have built and are continuing to grow. Hi, everyone. I'm Dr. Kang, and as Dr. Deb said, I'm the Health Policy Director for Congresswoman Pramila Jayapal. And I wanted to talk to y'all just really about sort of the inner workings of what's happening in Congress and how to effectively engage with legislators. So Matt's going to talk about, he's going to talk about, how you can do that on an individual one-on-one and how you do that and what are those skills. But I thought it would be helpful for people to know what is really happening in these offices that can impact perhaps your perception and your ability, and also optimize your potential to be able to effectively engage with them. What goes into thinking through how to craft health policy legislation, how to move it forward, what goes behind the strategies. And so hopefully this is going to be helpful, but it's also the perspective I'm going to provide is very particular to our office. Every office is incredibly different. The way we like to describe the Hill, or at least the House, is that it's about 435 different fiefdoms. Everyone has a different process, a different structure, a different staff. And so again, this is going to be very, my perspective, but I hope it's going to be translatable in a lot of different ways. So first, I also just want to provide context into the way that House offices operate. And so, when I arrived on the Hill, 2019 in February, I was really ignorant of this space. I had mostly worked in global health and barely knew the difference between the House and the Senate and what was Congress and emailing legislators. Never ever crossed my mind to do any of those things. And so when I came, I was told I was going to be working on health reform policy, Medicare for all. And I thought that the way that government works or Congress works would be this huge team of experts. It would be this huge team of health policy experts working on crafting this legislation because it was huge. And I arrive and it turns out that I'm the only one in the office, let alone in the entire House of Representatives, who's going to be working on Medicare for all. And so that was really crazy to sort of grasp. But to go beyond that, I'm very lucky. There's very few people on the Hill who get to specialize in a policy area. I can only think of one other health policy director in another office, but usually legislative people have a huge portfolio. I mean, for example, in our office, they might cover education, labor, foreign affairs, transportation, and then 50 other topics, right? And so very few people who are working on health policy really get to hone in on health policy. Some offices you might find a health policy advisor, et cetera. But this is really just to shape your perspective then that these people, one, tend not to be actual health policy experts, or perhaps there are very much policy experts and health is one of their portfolios, but don't often come from actual healthcare backgrounds. And so that's what you'll get to leverage, right? As physicians or training physicians, physicians in training, you'll be able to really leverage that piece. And so that's just sort of to set the stage. And then, to dive into some of the health policies, because, something that they wanted me to cover on today is what makes good health policy. It really just depends. It depends on what is the goal, depends on the political moment, depends on what you're responding to and who you're working with. And so I'm just going to share a few slides here just to give an idea of some of these pieces. If I do this correctly, let's see here. 1 second. Okay. Can everyone see my screen? Yes, I'm just going to assume yes. Awesome. And
Yes.
so here is, thank you. Here is just a handful of policies we're working on all at the same time. And so, as mentioned, Medicare for All, Medicare for All is a huge policy. I'm going to go a little bit deeper into that one because that one just has pretty much the most politics and policy mechanics involved. And I think it'll be really interesting for you all to hear about how that happens. But we also, just introduced a bill specifically targeting research and raising research and awareness for South Asian heart health, right? Very niche. We also introduced a resolution about providing sex education for all people. We also provided another piece of legislation for survivors access, survivors of sexual assault and access to care. And as you can see from that stat, only 17, 20% actually have the resources that hospitals would need to be able to provide, either follow up or access to testing, et cetera, for people to be able to access what they need. And then another bill that we're working on is it's called Lift the Bar. And basically what it would do is lift the 5-year bar that currently exists for lawfully present immigrants. So these are green card holders, et cetera, who have to wait 5 years to access Medicaid, CHIP, and other federal programs. And so it would lift that barrier plus others for them to finally, if they're a green card holder, the other taxpayers, they would be able to access those services. And then the bottom left here, and I believe DFA endorsed at least our bill, but we're working on a bill and a letter because I saw y'all post about it recently. It's called the NOVID Act. We're doing that with Rep. Krishnamurthy, but also the Congresswoman has also just introduced a letter around the need for achieving rapid and equitable global vaccine distribution. And so this chart in the left is really just a graphic that was made recently about how long at the current pace would it take for countries to be actually covered. And so this is really just to provide, again, sort of a snapshot into all of the different policy areas. And each policy area has a different story about how they came to be. They have a different process about what went into it. Some were legislation that had already previously existed. So there wasn't really a lot of work to do. And you have a few key partners so that's, for example, that's the Sexual Assault, the Survivors Access Act. And then for the South Asian heart health, that was actually due to a personal story where we had our legislative director, who is South Asian American, whose mother passed away from a heart attack, and it was very abrupt and it seemed random. And then he found out it actually wasn't quite random statistically. And so this is how that legislation came to be, and also in collaboration with researchers who were doing this. And then Medicare for All, of course, is really the most collaborative process that we have in terms of the policy that's being built. And so, so if you're thinking about what goes into a policy process, for our office in particular, we're very, very big on collaborating with our outside groups. We believe, especially in health policy, we know health policy is extremely political, it's extremely contentious. You cannot do it without your outside groups fully in support and in coalition. And so I thought I would just go in really quickly into some of the policy actions that legislative offices can take in order to really move forward a policy. And so again, I'm just going to use Medicare for All because it's really one of the biggest legislations we work on, and has had a lot of traction. And so a really big part of the legislative process after you've crafted a bill, and I'll back up a little bit, when you craft the bill, we worked very closely with physicians, would love for Doctors for America to be involved with us in the next iteration. But because of course, you guys are on the ground. If we're going to be, reforming the way that hospitals are being reimbursed, if we're going to be reforming the way that people are getting coverage, we absolutely need to have that provider perspective and make sure that those are reflected. And so we try to do as much work as we could to get, feedback from physicians, labor unions, nurses, the Disability Rights Coalition, racial justice organizations. And so once that bill was crafted, then you have that first step in the legislative process. And that's really to get congressional hearings. Usually the way the proper process works is that you introduce a bill, and then if there's enough momentum for it, that bill will get a hearing in a committee of jurisdiction. And so for any health bill, that'll have to go through Energy and Commerce and Ways and Means committees, plus some others depending on the scope of the bill. And these are really powerful health policy committees. And when you get a hearing, you're basically allowing members to finally have a policy debate, a policy conversation, right? And a lot of times we have witnesses who are physicians to speak on these issues. And so that's another area for physicians to really make sure that they're inserting themselves. You can insert testimony, et cetera. And so I'll go into that, what that looks like, because I think sometimes we think a lot about the actual policy, but there are steps after the policy is introduced that the physician voice can be reflected. And I'd be happy to dive into that deeper in the Q&A. And then again, really thinking through our advocacy network and who's pushing it on the outside, who's constantly having conversations with policymakers. Health policy is complicated. Health policy is really hard to grasp and hard to talk about and hard to understand. And so the more people we have on the Hill engaging offices, talking about the policies, talking about the way it would impact them, sharing their stories is really powerful. And so that was something we really focused on, is really having providers, engaging with providers and having them share their stories, as well as academic experts and business owners, to really show that diverse perspective on the way that the health reform would impact them. And then, of course, once a bill is introduced, but also before it's introduced, you really want to make sure it has strong support, right? And the way you do that is by having co-sponsors. And so it's something that we love to say is that we have over half the Democratic caucus, right? So that's over the majority of the Dem caucus on the bill. And that's really to say, because you want to make sure that people know it's not a fringe idea. It's not something that's just far left. It's actually a really popular idea to be able to reform our healthcare system. And this goes for any of our health policies. You have to build up support as much as possible. And you want to make sure we're engaging with key Democratic leaders. This means committee chairs, right? The committee chairs are powerful. This means leadership members, including assistant House Speaker. And then lastly, a big part of this is around messaging. This is messaging inside and outside, and we love to collaborate with our outside partners around talking points, around publishing op-eds, around producing white papers. Some of the most powerful white papers and articles we have used for our purposes is articles that have been published in JAMA or in the New England. And so, these are usually physician authors. And really, I don't know how y'all do it. I know you're busy. A lot of you are either probably seeing patients right now and you've taken a break, or perhaps this is your day off. But really incredible when also providers are able to also take the time to be publishing these ideas, because policymakers need them. We need to be able to point to actual published peer-reviewed data to be able to make our cases. And so the last thing I'll share is really just policy resources, because I want to make sure we get to Matthew. When I was thinking about this, about where to study good policy and what good sources to use and what I've used throughout my time, when I started at this position, I remember I was being interviewed and they're like, make sure you're like following all of the top health policy reporters, and I'm sure you're already on Twitter and blah, blah, blah. And, it was a phone interview. So I'm like creating my Twitter account as we're speaking, being like, yeah, of course I'm on Twitter. I did not realize like how big of a resource Twitter is, and how just how up to date you can be when you are properly following Twitter, and, being able to stay engaged with what's going on. But these are a few other, when I was thinking through my top policy resources, of course, I Google a ton and, try to make sure my resources are good. But, Kaiser Family Foundation and the Commonwealth Fund always produce really fantastic reports, and they have great data. They also have really great surveys, which is really important. And then Public Citizen is a think tank. It's a very progressive think tank that tends to focus more on consumer rights, but also it does a lot in health policy space. And so they produce a lot of white papers. And then also there's Politico Pro. I'm not sure if everyone is familiar with it. And if you are, awesome. I had never heard of it until I came onto the Hill. So there's Politico and then Politico Pro. And basically the way I can describe it is like, it's like the Gossip Girl of the Hill. And it's just always giving you updates about like what's happening. And there's this conversation that happened, because when we're thinking of health policy, we can't just be thinking of this from just a purely policy standpoint. We have to be thinking of the political dynamics that are at play in order to be able to influence people and get people into the direction that we need, right? And so these are the sort of like off-cuff policy resources I can think of, but again, really can't stress just how incredible and how important and critical it is that we have physicians engaged on this. And throughout the entire history of health reform, many times physicians have simply just not been on the right side of history. And I think DFA is taking such a leadership role in this, and it's so awesome to be able to, ensure that we're reflecting a diverse set of voices when it comes to providers and what they're experiencing and how health reform and health policy overall should be influenced. And so I hope we can have an engaged and dynamic Q&A. Happy to answer any questions around anything I mentioned. If I used any terms that weren't clear, please let me know. And that's all.
Thank you, Dr. Kang. That was excellent, an excellent introduction to a lot of things. Especially, I appreciate how you described 438 fiefdoms in the House.
Yep.
So I'm just thinking Game of Thrones suddenly, and again, I'm sure it gets very, very complex navigating all of them. And I also appreciate how you emphasize that, physicians, we have a way to sort of make our voice heard. We weren't always on the right side of things. And a very short history point is that a long time ago, a fellow Ronald Reagan, you might have heard of, actually worked for the AMA, and he lobbied against the creation of Medicare and Medicaid for our elderly and our poor, so for the AMA. And so sort of representing physicians, that was a long time ago. But in any case, we have to sort of make sure our voice is being used for what we want it to be used for. Okay, thank you very much. Now let's move over to Matthew here. And Matthew is going to speak a little bit more about how directly to sort of speak to legislators. Okay, go ahead.
Yeah, so let me go ahead and try to share my screen here so folks can see my slides. So give me 1 second. Can everybody see that? Can I get a thumbs up if folks can see that? Awesome. Okay. Yeah. So to introduce myself a little bit, I'm Matt Wellington. I'm the Public Health Campaigns Director for US PIRG, which is the Public Interest Research Group. And we are a consumer advocacy group. We've been around for about 50 years. We focus on a lot of different issues, ranging from, ensuring folks aren't getting ripped off by banks and financial institutions, making sure that there are no toxic chemicals in consumer products. And then, of course, we also work on health issues. And so I oversee all of our health work at the national level, but also with our state-based partners, because we have a state-based group in about half the states across the country. And that, I think, is really helpful for us because we're able to reach into all different levels of the policy landscape. So we can work on city level policy, we can work on state level policy, and of course, federal policy as well. And I think there's some principles for effective lobbying that I'm going to share with you all that you can translate into pretty much any of those settings. I think the tips and to do things to prep before, things to keep in mind during the meeting, things to do after the meeting. You can apply this to any level, I think, of government lobbying. And just to emphasize our role in the public health community. So I am not a infectious disease expert or anything like that. I focus on communications, mostly in advocacy. So that is something that we are experts in from PIRG. We know how to get messages out there in a compelling way. We know how to think through, our strategy for how we're going to move an issue forward and how we can organize the right people and get their voices heard at the right times. And so I think that's the role we play in health policy, is we are really a bridge between public health experts and medical professionals like yourselves and policymakers and the public. So yeah, we're going to jump into some basic lobbying tips. And I think this is going to be a pretty broad overview. I'm happy to answer any questions that folks have about their own lobbying experiences if you all have lobbied before. And so let's jump in here. And it's basically going to be structured as things to keep in mind before the meeting, how to prep for the meeting, a basic agenda of an actual lobby meeting, and then things to keep in mind after. And before we dive into some of the key points here, I will just reiterate something that Dr. Kang mentioned, that staffers on the Hill in particular, they have so much going on, right? Like I just had a staff person, I was meeting with them about antibiotic resistance and the importance of reducing antibiotic use in food animal production. And she told me, like, thank you so much for reaching out and getting this back on my radar, because honestly, there's too much going on. I never would have been able to pay attention to this. We were flagging a pretty obscure policy change in the FDA that's actually really concerning, and asking her office to put some pressure on the agency to do better. And so that just, goes to show that, yes, these folks are super busy. They're covering a ton. And so I think one of the most important things you can do as public health professionals and medical professionals is to present yourself as a resource for legislative staffers, right? You're the experts. You can weigh in on policy. You can weigh in on how to craft these kinds of legislation. And so I think just to absolutely reiterate that point. So some key points about lobbying. I think when people hear the term lobbying, they immediately think of like some dramatic, instance where I think of that movie. I don't know if it's called Mr. President. It's like a romantic comedy from the 90s where there's an environmental lobbyist, ends up dating the president, but in the beginning they have a lobby meeting and she's very like forceful and makes threats. And that's what I think of. I think it's what most people think lobbying is, like pounding your fist, making threats, saying we're gonna come after you if you don't do this thing, or like, I don't know, even darker, money, bribes, that kind of thing. It's absolutely not any of that. Effective lobbying is about persuasion. It's not about pressure. What I mean by that is when you're actually meeting with legislative staff, or of course with a legislator themselves, your role as what I consider a public interest lobbyist, which I think would, everybody here would fall into that category, is to persuade them. It's to make sure you're giving them the best available information. It's to make sure that you are answering any questions that they have about the policy that you're pushing for. It's also about giving them compelling reasons to say yes. So this last point here, you want to think through not only what are the reasons they should say yes to your ask based on just the merits of the case. So on antibiotic resistance, when I talked to a legislative office about that issue, of course, I mentioned the fact that if we don't stop the overuse of antibiotics in food animal production, we could be looking at a world where common infections are much more deadly than they are now, right? Routine surgical procedures will be much more dangerous. I think everybody on this call probably knows all of that much better than even I do. But you also have to think, what are the compelling reasons for this particular legislator to say yes to this problem? So when I meet with my legislative office in Maine, where I live, about antibiotic overuse in farms, I tend to talk about it in terms of how the elderly populations are most at risk for antibiotic resistant infections, and especially like foodborne infections. And that's because I know that Maine, I think, has the #1 population for people above 65. So I know that is a huge constituency for these representatives, and a block of people that they are constantly thinking about, how are issues affecting these people here in Maine? So again, it's about persuasion. It's not about pressure. It doesn't mean that you can't pressure lawmakers to do something, but that usually happens outside of lobby meetings, right? That's what all of the organizing and the outreach is about. That's how you create pressure. But when you're actually in that room or on that phone with a legislative staffer or a legislator themselves, it's about persuasion. And the second point here, it's absolutely about long-term relationships. You want to be thinking through, how do you, for folks on this call, how do you present yourself as a long-term resource for these policymakers, right? I think the ideal situation is that everybody on this call ends up being like a policy resource long-term for years and years for the representatives that are representing them in their districts, right? So it's about long-term relationships. I've been working with some offices on the key issues that I cover for the last 8 years, right? So keep that in mind. Again, this goes over a little bit of what I just said, but role of a public interest lobbyist is about providing information, persuading decision makers, and then this last point I didn't mention before. This, I think, could apply to some folks that are on the call, especially it applies to DFA, because I know that you also do great organizing work in advocacy, which is why I've really enjoyed partnering with DFA in the past on a lot of different issues. You need to bridge the gap between what we consider the inside game and the outside game. The inside game, pretty simply, is just anything that happens inside, the Hill, the Capitol, when you're doing federal lobbying. That's the lobbying. That's the inside game. It's about the relationships you've got with the legislators. It's about the political dynamics happening on, the Hill at that time. The outside game is all of the organizing and outreach work you're doing to build the support you need to move legislators in the right direction, right? So that's the 20,000 petition signatures that you're going to gather on a legislative effort that you're pushing for. That's the op-eds that you're putting together that you want to show that this is in the public's eye. So it's your job as a lobbyist in these settings to help bridge that, right? So you want to be able to bring, and we'll talk more about that in a second, you want to be able to bring some of that into the meetings that you're having with legislative staff to show the kind of support that you bring to bear on this issue. And I think one thing I've kind of touched on, but just to dig in a little bit more, education is really key in a lot of lobby meetings. Again, these folks cover so many different issues. I just took part in a lobby day for the Baby Food Safety Act, which was introduced recently by Representative Krishnamurthy and Representative Cardenas. And that issue is about setting maximum allowable limits for toxic heavy metals in baby food. And that is an issue that not very many people paid attention to until the Oversight Committee came out with this great report that showed that in many baby foods, there are unbelievable levels of lead, arsenic, cadmium, mercury, and there are no limits from the FDA to regulate that in finished baby food products. They regulate the ingredients, but they don't regulate the allowable limits in finished baby food products. And so they introduced this bill. When we met with offices, like tons and tons of member offices about this issue, one of the first things I heard from staffers was, I had no idea that this was such a problem and that there were no allowable, maximum allowable limits from the FDA. So it really is about education is the first step towards engaging member offices. Persuasion, I already talked about that, and then access and influence. For folks on this call, I think really you're going to be able to build your access and influence by being a solid resource for these people. So you want to present yourself as a resource on, whatever your particular issue area is. And so, for example, for me, I have tried to build my access and influence on the Hill over time by just being a good resource on antibiotic resistance, because that's that's the issue area that I do most of my federal lobbying work on. And so I've, again, worked with offices for many years who, when they have questions about antibiotic resistance or antibiotics related legislation, they ask me. And so I make sure that I either answer those questions for them, or I definitely make sure that I can find the answers for them. And so that's another thing to keep in mind, is you don't have to have all of the answers all the time, but just make sure that you're able to find the people who do and connect the offices to those people. So it's fine to say, I don't know. If you get questions like, don't go outside of your issue area, don't pretend you know something that you don't, but just make sure you're presenting yourself as a resource who can help find those answers if you don't already have them. And that'll help, build your access and influence with offices. Before the meeting, oh my God, so this is a throwback Thursday photo. This is one of the first lobby meetings I ever did. That's Senator Paul Pinsky in Maryland. It was with the Maryland State Legislature. That was a lobby day about a bill we were working to pass on antibiotics in the state, which we actually ended up passing. It's the strongest bill in the country to reduce antibiotic use on farms, which is pretty great. And yeah, there you go. So materials on the issue you want to prep before the meeting. This could include reports that you want to bring, fact sheets that you want to bring and highlight during the meeting. It can include some of the demonstrative support that you've been able to build. So again, bringing that stack of 20,000 petition signatures or 100,000 petition signatures that you've been able to gather, or, again, bringing the op-ed that you wrote and have printed in your state paper. That's a great thing to bring to the meetings and actually hand to the staffer. And then, of course, before the meeting, you want to do research on the legislator that you're going to be meeting with. So you don't have to do a really deep dive. I mean, people who do this for a living tend to go a little bit deeper. Like I will tend to go a little bit deeper if I'm meeting with a legislator, but just the basic things, right? Like understand their basic voting record on the issue that you're going to be trying to get support from them on. Understand how they have typically, obviously how long they've been in office. Try to understand like what have their elections look like, because that would be good to know if it was a landslide victory for them, or if they're constantly in tight races when they're running for re-election. That's good to know. Figure out what they're saying just on their websites, right? Like look at their websites and see what kind of issues that they highlight on their websites, because clearly those are the things that they're going to really care about. So just do some surface level research at least on the legislator that you're going to meet with. And if it's not in your district, if you're lobbying on, in somebody else's congressional district, do a little bit of research on the actual congressional district, right? Like whenever I meet with an office, I make sure that I try to take a look and figure out how many CAFOs could be in this district, right? Am I lobbying a congressional office who has a massive ag presence in their state? Because that's going to influence how I talk about some of the antibiotic use legislation we're pushing for. And these are just some simple resources for you to do some of that research. So govtrack.us is a good website where you can track different legislation. You can track how legislators have voted. Congress.gov, of course, is one of the main websites where I am looking up the legislation that I'm working on. Actually, when Dr. Kong made the comments about getting really a strong list of co-sponsors, I immediately checked on one of the bills that I've been working on, which I've been trying to build up the co-sponsorship to see where we're at. And I went to congress.gov for that. Like I said, the legislators website, and of course, news outlets in the legislators district or state. Definitely a good place to look and just see, how are these media outlets talking about the legislator. So I'm running out of time, so I'll wrap up really quickly here. In the meeting itself, top tips are listen as much as you talk. This is for you to get a sense of what are the motivations of this office. How is the staff member thinking about this issue? How is the legislator thinking about this issue? So listen as much as you talk, ask open-ended questions so that you can get at what their motivations are. Why would they say yes to this? And you can use that when you make your ask. Make a direct ask. It's great to have initial meetings when you're trying to meet legislative staff for the first time and just build relationships. You don't have to have a direct ask for those meetings necessarily, but after you have that initial introductory meeting, definitely have a direct ask for staffers. They're super busy. They want to know that, I think you're meeting with them and you have something that you want to ask them for, right? So make a direct ask, whether it's co-sponsoring legislation, voting for legislation, whatever it might be, and then make a clear follow-up plan. This is a typical meeting agenda, super quickly. So just introductions, make sure you introduce yourself, make sure you thank them. That is a really key piece. I had a meeting with a senator, I won't name names, but a senator who I met with them, not their staff. And I didn't thank them right away. And they actually brought it up in the meeting. They said, I can't believe you haven't thanked me yet for that vote that I had last week. And I was like, oh my God, you're totally right. That was a great move. Thank you for that. So make sure you thank them right off the bat, either for a specific vote that they've done or just generally for supporting issues you support, or even just for meeting with you. And then you want to go through why you're here, problem, solution, make your appeal based on the strategy. Again, make your direct ask, get feedback. Again, listen as much as you talk, reinforce the commitment and follow up. And then tips really quick. So make a connection. Use your personal story. That's one of the most powerful things that I think this audience can do. Use your personal story to nail the message of why the legislation, the policy you're pushing for is incredibly important and will affect real people. Stay positive. Don't be cynical about legislators' motives. I think typically people want to do the right thing. So keep that in mind and then think long-term. That's it. Thanks.
Thank you, Matthew. I appreciate a lot of things you said there. I guess if I'm going to get back on camera here, and if Dr. Kang will as well. And I'll just point out a few things in order there'll be plenty for us to talk about that. I appreciate how you brought out the inside game and the outside game. Both of you have sort of helped us understand there's in the Hill and outside, how positions we should consider ourselves public interest, groups if we want to be. And to sort of take the consumer view of things, and to persuade, don't bend anyone's arm or break anyone's arm. That's not the goal. So we'll start off with some questions here. So the first one, I want to start off with Dr. Kang here, especially now regarding nowadays. It's probably always been this way, but we know much more clearly now that it's polarized times. Constantly in the news. I'm surprised any Congress people talk to each other, even the way they talk about each other. But for especially considering Medicare for All bill and everything, if we wish to sort of support Medicare for All or other things, and we do support it, should we reach out to anyone and everyone? Is this sort of a long enough game that we should just sort of have an open mind? Or should we sort of deliberate carefully on who we talk to? How do you think we should negotiate that? What would be effective?
That's a great question. And I think it depends on the policy, depends on the when, and it depends on what's going on. And so, if it's like a last minute push and you need to have as many co-sponsors as possible, as quickly as possible, probably being really strategic with your whip list and who you're reaching out to and making sure constituent, like if you have, all your doctors reaching out and they're reaching out to their actual Congress members that they're constituents of, just a very more rapid response approach. But I think especially with COVID, the conversation around health policy has changed a lot and what people are open to. And we have members who are on, Medicare for all who have never been on a single payer legislation. I mean, that's huge to me. And so that tells me that even also in the fact that like we have an administration who is not supportive of single payer, the fact that we have more support inside Congress than we've ever had, I think it's always worthwhile to engage in this conversation. So as you said, the Medicare for All strategy is a long-term strategy. And so for that, absolutely. I mean, I've even had advocates talk to a Republican office before and report back. Of course, they're not, it's going to co-sponsor or like super supportive, but there were aspects that they could speak to, that they connected with, and that they could have that conversation. And you just never know. And you never also know what are the either misconceptions or what are the policy reasons or political reasons that are in the way. And so engaging in those conversations with staff and also with legislators directly to find out what are their concerns and then being able to speak on those concerns is huge. And so I always encourage people to never close doors, never assume no until you get the no. And even then, still push.
Got you. That's very helpful. So I like how you put it. So it depends on sort of the policy and the when and the what's going on. And fortunately, sometimes, for your organization can kind of give you a blast about when the last minute has come, saying, call your senator, call your congressperson. And it's also reassuring to know that COVID-19, as expected, has changed the healthcare conversation. And that even opponents are, that are theoretical or real opponents, they may support aspects, and you never know. And I'll just repeat one quote that my old sort of chairperson said. He said, even when someone's trying to do the wrong thing, they're trying to do the right thing. So, maybe we can see that. Okay. And the next question I have is for Matt here, Matthew. I'll just ask this. When a physician sort of advocates for anything, is sort of stepping into any office, is it sort of understood that they're a consumer advocate, that they're a public interest advocate? There are plenty of, my experience back on the Hill again was, seeing the lobbyists come in saying, do this or we're not participating in the Medicare program. That specialty society will go unnamed right here. But is it understood that physicians are consumer advocates? Should we be bringing consumers with us? Do we have to convince people of that or anything?
Yeah, I mean, I think I see a big difference between somebody representing like a trade organization or some kind of association than I do with an individual physician or medical professional who's reaching out to their office. So, that obviously will depend on who, even though you're a physician, it doesn't necessarily mean you're on behalf of the public interest. Who are you representing, right? You have to be clear, who are you representing? And so I think it's really just about how you carry yourself and the kind of message you put out there. So as I said, it's about providing resources. It's about persuasion. It's about, setting yourself up as a resource for the staffer. And we think of ourselves as like the white hat lobbyists, right? Like we think of ourselves as we are there to kind of hold the ground on just the facts, right? So we're, obviously we think behind the scenes about the kinds of outside game we need to bring to bear, again, bridging that inside and outside game. But the first thing we always do is present the facts, right? We're there to give the right information to people. And sometimes that's all you need to do. I mean, it's certainly not the only thing that will make a difference many, many times. But like I said before, the baby food issue that I mentioned, just laying out the facts for people, several offices, like that was enough for them to really dig into this issue because it just wasn't on their radar at all. They had no idea. So yeah, I think physicians typically if you're representing yourself as a physician or on behalf of your patients, I would see them as a public interest lobbyist. But again, it depends on who you're representing. It doesn't always mean as a physician you're there for the public interest. So just make sure you're clear who you're representing and what you're there to do.
Just a quick follow-up to that. It's curiosity here. Are we stronger if we're sort of coming in arm with consumers?
Well, I guess, what do you mean by consumers?
Oh, someone representing a patient, meaning like
Right.
not necessarily a provider. A question for both of you can answer.
Yeah, I mean, I think it probably depends on the situation, but I think it's really powerful to have a physician talk about, I can use antibiotic resistance as a good example of this. I, as much as possible, bring infectious disease physicians to my meetings to talk about what they're experiencing on the ground treating patients with infections that they say they could have treated 5 years ago with conventional antibiotics, and it's getting harder and harder. I think it would be even more powerful if I brought an infectious disease physician and a patient who struggled with an antibiotic resistant infection, to have that kind of 1-2 punch. So yeah, I think for the most part, it is really compelling to have a physician talk about how I am seeing this problem on a large scale with many of my patients, and then have that really deep personal story of a patient themselves talking about how, yeah, I was in the hospital for months with an antibiotic resistant infection. I almost died. That I think is really powerful.
I can just add one thing to that too. I totally agree with everything Matthew said. And I'll say that most often, and I think when people on the Hill or staffers imagine what it looks like when providers come onto the Hill with their white coats, it's usually coming from an association, and it's almost usually about how it impacts themselves as a provider, not really about the consumer. And also about their salary, right? Like that tends to be the conversation. And so any effort, I think, to make sure that the conversation is broader than that there are doctors who are having deeper conversations and bringing consumers, I mean, that's just not common. And so I think, as Matthew said, that would actually be really compelling for that to be hand in hand.
Thank you for your thoughts on that. And especially how you put it, when we come in with white coats, people might have preconceptions about us. Dr. Kong, I just appreciate that you're in service to all of us on the Hill. And I think some of us, we want to know, what's the best thing we can do for you, as a congressional staffer? What can we do most in whether we're doing it during a meeting, or even or is it something, whatever we can offer outside of meetings? What's the best thing we could be doing for you, like explicitly or implicitly?
Sure. There's a lot of things that come to mind, and I appreciate the question. And I think Matthew touched on this, but definitely just understanding most of the time, if there's no response, it's not intentional, and there's just a billion things going on. And so, operating in good faith is really important. And, I understand these issues are personal, these issues impact, your everyday lives. And so sometimes it can get quickly emotional, and I understand that piece, but I think that just understanding what's going on in the Hill and having that good grace is really important. But at the same time, you have to advocate. Of course, you have to advocate, and you have to be persistent. And so just making things as easy as possible. Physicians, y'all are incredible, and y'all have gone through lots of training. Y'all have developed a very specialized language. And so, I find that sometimes doctors forget how to talk to normal people. And so I think just really practicing that way of communicating, both verbally and written, and having emails also that are just easily accessible. The easier the emails to read, and I know exactly what you want, the easier I can respond. If I have to go through many paragraphs to find out what's going on, probably going to flag it to read it for later. And that's just the way that we have to prioritize. It's not a reflection of the priority. And so just any ability, also really just building up that relationship. I really can't explain how important relationships are, especially if, let's say, it's something that DFA is actually working closely. It's a legislation that the office has agreed to say, this is what we're going to work on. I think coming up as much of a plan to make sure that things are working hand in hand, that there's a clear expectations around who is doing what, and also just like the involvement of the policy, I think is really critical. And so I'd love to see DFA do more, frankly, on this, and being able to, introduce policy ideas and really working intimately with offices to, from start to finish.
Can I add one quick thing too? Yeah, something Dr. Khan just said stuck with me, that like, remember, you're not talking to medical professionals in these offices for the most part. I had an experience in a lobby meeting. I brought one of my physician partners, brilliant person. We were talking about antibiotic development, and he launched into this tirade that, like, I saw the staffer's eyes glaze over, my eyes glazed over. I was like, oh my God. So I jumped in and I just, helped to facilitate, like, can you clarify? So I would just say, for folks on the line, practice your talking points beforehand, and keep in mind, you're not talking to a medical professional. So how are you going to raise these, pretty complicated issues on healthcare policy or whatever it might be in a way that's just going to immediately land with them? So yeah, I've definitely had that experience of watching that play out in the wrong way. So yeah, remember, you're talking to folks who don't have as much expertise, and it's helpful to just practice beforehand.
Thank you both for your insights there. Especially, I think one thing Dr. Kong is telling us, that if we feel strongly about something, the longer the email doesn't necessarily make our message more powerful. In fact, just sort of keep your points short. And I like how you said, make a strategy for working hand in hand. And I believe I know what you mean by that. So operating in good faith. So this is very helpful. And Matthew, I appreciate you're also telling us that sometimes we pride ourselves on being good lecturers, or revered or something, or our aunt is really proud of us for being doctors or something. But we shouldn't go lecturing everybody, I think you're telling us.
Yeah, I think that's one part of it, but also it was just so in the weeds that
Okay.
I could tell the staff person just wasn't following along, right? Like, that's more of my point. I think everybody on the call, you can probably get really into the weeds on healthcare policy and the ins and outs of it. And so just remember, your message has to land with this person, and they might not understand that kind of lingo. So break it down for them in a way that would just be totally easily understood.
And super quick note to add to that, do your homework. If you're talking on a topic that office is already championing or is really active on, you probably don't need to go into all the background, because it also can feel not only redundant, but also as if, like, okay, this person's not really engaged. They don't know we've already been working on this for months, like, right? Like, then the conversation kind of starts to stall. And so making sure exactly, like, that you're talking to the right audience, and that you tailor each office. You should not have one pitch for every single office. There's definitely a template, but there should be adjustments made depending on what those offices are working on.
That's both excellent insights, that we should not get go into details in a way that's not helpful for folks. And also, we know who we're talking to, because who we're talking to, that's often public information, because we'll know sort of a congressperson's position on something. So we should assume some amount of them. And thank you again for reiterating what my grandparents and my parents said, do your homework. That's absolutely key. So we have another question here about doctors showing up in white coats. Do you think physician advocacy is most effective on those mass legislative days? Or are sort of one-off meetings just as effective, maybe when it's not sort of rush hour for lobbying?
Do you want me to? I can chime in first. I think it depends on what's your goal, right? Like, the lobby day I mentioned on the baby food issue, our goal was to just really quickly cast a wide net and educate offices. And so that was effective for that purpose. It was not as effective for really digging in with offices and trying to understand, what would their motivations be around potentially co-sponsoring this bill? How can we work together more closely? Because the meetings were about 15 minutes long, right? And they were just kind of back to back, boom, boom, boom. So it was good for that broad education. And I think that's what most lobby days are about. It's about getting that broad education, but also just showing that it's kind of it's a tactic, right? You're showing that demonstrative support. We've got this massive support from physicians on this issue. So that is good for those purposes. I would say, like, if you want to really build your relationships with offices and try to be more hands-on with the strategy, then the one-on-one meetings where you can have a bit more of a discussion are really more helpful for that.
And just to add to that, I guess, yeah, like Matthew said, it depends. I think like if a legislative advocacy day is like timed with really well with a certain priority, then that's like super helpful. But usually the timings are, sort of ambiguous and depending on when the summer and et cetera. And so I find a lot of times like on those mass days, there tends to be several mass days happening. I don't know if y'all have ever been to the Longworth cafeteria. It's the cafeteria on the basement of the Longworth building, and it just gets swarmed with lobbyists. So you can see all different colors and like the t-shirts. And what I'm saying is that there's tons of priorities. And so usually that policy staffer gets inundated with about 10 different requests with several different policies that they've been asked to co-sponsor. And so follow-up after those mass days are super, super important. One-offs, I would say, like, but definitely year round. I mean, like Matthew was giving that example, there's so many times where I'm like, there's a piece of legislation that is a huge priority for my boss. And, I know this is being recorded, but sometimes like I don't notice that it's been introduced or it's about to be introduced. And I know she'll want to be an original co-sponsor of it. And an advocate or advocacy group will flag and be like, hey, like just making sure, like, we know this is a priority. This is getting introduced tomorrow. Thank you for that. Awesome. And then I'll make sure that she gets there. Right. And so I think having those meetings in between are really important. And, I think when we're thinking through with physician engagement in terms of just like year round, there's just I find that when it comes to like the most effective lobbyists, like they are not just there on the mass days. And what's really tends to be really effective, and I think this is what Matthew is doing, is there tends to be like a one person, like a liaison for that group that is going to be the person who's really effective. And so it's not like every single member of DFA needs to be constantly engaging, because actually that can be scattered. You might have different messages that you're sending out and people have gotten already responses from office. They don't realize it. This happens a lot where there's different chapters. And somebody be like, what's going on with this? And I'm like, I've already relayed this to this other person and it's not being communicated. So I think as much as the communications can be streamlined is really critical.
Those are excellent help from insiders here again. And so it sounds like the most effective lobbyists I've heard are not just there on mass days, to sort of also be sort of streamlined amongst our organization. It's excellent help for us. Okay. So as we're coming on the end of the hour, I want to respect everyone's time. I want to close this Advocacy Grand Rounds by thanking our speakers for this great conversation. Again, this is Dr. Stephanie Kong and Health Policy Director for Congresswoman Pamela Jayapal, and Matt Wellington for US PIRG. And we'll have a second Advocacy Grand Rounds tonight at 8 p.m. And it'll still be us. The jokes will not change. But this will also be there for anyone who could not make it earlier today. So please go ahead and share this opportunity if you'd like to share this with other people who couldn't make it during the day. This will also be available on DFA's YouTube channel later. There will be a survey at the end if you can complete the survey so that we can continue to sort of get your feedback on content for these grand rounds. You'll find the survey link in the chat as well as in a follow-up email that you'll receive tomorrow. Please remember to follow us on Twitter, LinkedIn, Facebook, stay up to date with DFA and ways to get engaged. And check out the events page on our website. We have a couple things coming up. I'll just mention that next week, June 22nd, I'll be there again. There's a workshop on writing op-eds for gun violence prevention. And then there'll be phone banking this weekend about vaccine hesitancy in collaboration with Made to Save. So you just go to www.doctorsforamerica.org events. Okay, and also next month, July 8th, we will have our next advocacy ground rounds on media training, how to write an op-ed, with Dr. Cedric Dark, one of our board members, Dr. Dorothy Novick, and Alex Strauss, a health journalist. So I'm really excited about that. I will see my co-presenters later tonight, and thank you guys for tuning in. Everyone be safe.